A fair few friends have encouraged me to do a lot more medical videos this year, in addition to my football ones. For those of my viewers who don't know, I'm an obstetrician gynecologist, currently in fellowship training. This month is Cervical Cancer Awareness Month, so I just want to say something very short about cervical cancer. Generally, when we talk about cancers, we don't usually talk about causes, talk about risk factors, because even though for most cancers we know some of the changes that happen genetically and at the cellular level to set off the cancer cascade, very few cancers really have causes. But cervical cancer is one of the very few cancers that we can say this is the cause of cervical cancer. And in cervical cancer's case, it's the human papilloma virus, HPV. So there are so many serotypes or so many types of the virus, but some of them are oncogenic. Oncogenic meaning they cause cancer. And the good news is that this virus, the oncogenic types, there are vaccines against them. There's Gardasil, there's Cervarix, there's Gardasil 4, Gardasil 9, there's Cervarix. And these vaccines ideally are supposed to be taken before the sexual debut of either male or female. That means the first time you'll have sex. So usually for the it's encouraged that the vaccines are taken, from 9 to 15 years. Okay, but if you can't take it between this period, you can actually take it even as far as 26 years. If you don't have sex, you can even take it even beyond that. I've seen some people quote even in your 30s you can take the vaccines before your sexual debut. Even though it's encouraged that you take it from 9 to 15 years, you can actually take it even up to around 26 years. Even if you've had sex, it's still encouraged that it offers some protection. The reason why the sex is there is that it's a sex that actually exposes you to the human papilloma virus. So preferably you're supposed to get a vaccine before you are naturally exposed to the virus. And for me this is very important because even as we preach screening with the pap smear and all those things, the HPV DNA test and all that, really prevention is better than cure. If you're actually able to prevent it, then you don't even need to cure it in the first place, what we call primary prevention. And so we need to really pay attention to it. Unfortunately, this vaccine is expensive and not too available in our part of the world, but it's available even though not very widespread. So I would encourage especially parents who have growing kids that we should consider, if we can, getting them these vaccines, because that is what will really help us, so that we don't actually get to the level where we need surgery and colonization and all those things that is needed to treat cervical cancer. So I just want to talk about this key factor when it comes to prevention of cervical cancer.